Assalamualaikum warahmatullahi wabarakatuh and good morning. My name is Muhammad Ashraf Aiman bin Muhammad Allah. My method number is 264581. Today I want to talk about the symptom of autism. Have you even heard about symptom of autism? What is autism? What does autism mean for people? How to recognize the symptom to someone? Okay, autism, also known as ASD, is a complex disorder that involves speech and behavior difficulties. A wide variety of signs and abilities can be present. ASD may be a minor condition or a disorder in a special hospital that include full-time treatment. The issues in communicating and social contact are characterized by these problems. Individuals with ASD often exhibit minimal, repeated and stereotype interests or behavioral trends. ASD is present in people worldwide independent of ethnicity, culture or economy. Autism happens more commonly in boys than in girls at a 4:1 male to female ratio according to the stated authority of the Center for Disease Control and Prevention (CDC). In 2014, the CDC estimated that about 1 of every 59 children had an ASD. In early development between 12 and 24 months old, autism signs are normally readily visible. However, earlier or later signs can also occur. A significant delay in language or social learning can have early symptoms. The range of autism is rather wide. Few individuals will have very remarkable challenges. Others may not. In cognitive skills, speech and behavior disparities compared with those that are not in the continuum are the common trait. For your information, I will tell you a bit about the knowledge that I have been read at the internet and peer recommendation. Today, I will share 3 main about the symptoms of autism are issues with communication, prefer to be alone, sensitive to loud noises. Firstly, they will have problem with communication and social interaction. Children with autism spectrum disorder usually have difficulty in conversing back and forth. They can't wait and interrupt the speaker instead. You will conclude that the discussion is over and you will go as long as the other person speaks. Some children with autism spectrum disorder grips other people's emotions and thoughts very purely or not at all. Many with autism spectrum disorder also experience issues with the ability to interact with people in non-verbal fashion. You do not recognize, for example, the intent of waving to say hi or despair of somebody. Usually during speech, you have problems making eye contact. During talking to others, you do not have any facial gestures or other non-verbal contact. For someone with an autism spectrum disorder, the final fear of speech and social contact is the opportunity to attract or hold friends. They could be having trouble playing with other adults or making friends as a young child. They can tell in older children, adolescents not having or waiting friends and socially distance themselves from others. Owing to these complications, children with autism spectrum disorder are unstable and terrifying in the social world. Social experiences are unnatural and highly stressful. Often tend to stop them instead of accepting partnership. Instead, they prefer to live in the safety of the lonely woods themselves. They are not playing with anyone even without asking an adult to participate in regular playing behaviors. They often lack eye contact and instead focus on items or pieces of object nearby. They are remote from humans. When people with mild autism spectrum disorder, sometimes called elevated autism spectrum disorder, want to be cooperative. Their social understanding and empathy disorders prohibit them from communicating with others properly. For starters, the child will know that it should start communicating to other children with language. It doesn't know how to use them. Thought. Due to this, he might join a group of children and try to initiate a conversation by echoing a word he learns before rather than eyes contact and saying hello. For instance, this behavior is very disturbing for children who still do not understand autism spectrum disorder. Secondly, people who had ASD, they will prefer to be alone. The most prevalent signs in all forms of ASD include social problems. For example, people who had ASD and social problems, they will like do something alone. Certain ASD person, they do not respond the name by 12 months of age. They also don't like to friend with others and like to be alone. Maybe they feel comfortable to be alone. From my experience, if they have a problem with someone, they don't like to share to anyone. They will keep their problem alone. People with autism will be worse off if left alone. Lastly, they're very sensitive with loud noises. According to my peer, which actively update with his sister that had ASD, they are very like to stay in the dark room and very quiet. Actually, from my experience, I saw in front with my eyes. They are very sensitive with loud noises. As mentioned by my friends, usually autistic individuals are often oblivious to sensory information or oversensitive. This suggests that their sense receive either too much or too little input from their surroundings. If autism children are overly receptive to sensory input, hypersensitivity is named. These kids want to prevent sensory perceptions. For instance, when they hear loud sounds, they cover their ear. They also eat only foods of certain texture or flavor. They also wear only certain garments or refrain from cutting or brushing teeth. Autism is known as a hypersensitivity because infants are receptive to sensory input. These children pursue sensory stimuli such as wearing tight-fitting clothes, looking for objects to touch, hear or eat, or avoiding things with arms and legs. In conclusion, person who had ASD, they will have symptoms like problem with communication, like to be alone and sensitive with loud noises. Hopefully, parents who have children's autism will be more patient with their attitude. Okay, thank you.